Everyone wants to know what they can do to protect themselves from cancer. The good news is that our daily choices can make a huge difference. In this video, we're going to explain every habit that helps prevent cancer. We'll focus on simple science-backed actions you can take every day to lower your risk and build a stronger, healthier body. This is about taking practical steps to be proactive in your fight for long-term health. Let's explore these life-changing habits. First, let's talk about a healthy diet. This simply means choosing to eat a variety of foods that give your body the nutrients it needs to function at its best. It's not about restriction or complicated rules, but rather about enjoying a wide range of wholesome foods. A healthy diet is rich in fruits, vegetables, whole grains, and lean proteins. Imagine filling your plate with a rainbow of colors: the deep greens of spinach, the bright red of a tomato, the vibrant orange of a carrot. Each of these colors represents different vitamins and nutrients that your body can use. How does this work inside your body? The foods you eat are broken down, and their nutrients are absorbed to fuel everything your body does, from repairing cells to supporting your immune system. Many plant-based foods contain natural compounds called antioxidants. These helpful substances work to protect your cells from damage. Over time, damage to your cells can build up and sometimes lead to problems. By eating a diet full of these protective foods, you are giving your body a constant supply of tools to keep your cells healthy and strong. It's like having a team of tiny helpers that are always working to maintain your body's internal balance. The benefits of a healthy diet are immense and go beyond just cancer risk. Eating well supports a healthy weight, gives you more energy, and can improve your mood. It's a foundational habit that helps every part of your body work better. When your body is well nourished, it's better equipped to handle all of its complex jobs, including the processes that keep cells growing in a normal, healthy way. Here is a simple, practical tip to get started. Try adding just one more serving of vegetables to your dinner each night. It could be a side salad, some steamed broccoli, or a handful of spinach mixed into a sauce. This small change is easy to do and can be a great first step toward building a healthier eating pattern that you can enjoy for years to come. Next, let's discuss the importance of exercise. When we talk about exercise, we mean any kind of physical activity that gets your body moving. This doesn't have to be running a marathon or lifting heavy weights at a gym. It can be as simple as a brisk walk in the park, a gentle swim, gardening, or even dancing in your living room. The goal is to find an activity you enjoy, which makes it much easier to do it regularly. The key is consistency, making movement a regular part of your week. So what happens inside your body when you exercise? Physical activity helps your body in several important ways. It helps you maintain a healthy weight, which is a significant factor in cancer risk. Exercise also helps regulate certain hormones in your body. Some hormones, when their levels are too high, can encourage cells to grow more than they should. Regular activity helps keep these hormone levels in a healthy range. Furthermore, exercise strengthens your immune system, your body's natural system for finding and dealing with unhealthy cells. A stronger immune system is better at its job of patrolling your body and keeping things in check. The health benefits of regular exercise are truly remarkable. It not only helps lower the risk of several types of cancer, but it also improves your heart health, strengthens your bones, and boosts your mental well-being. People who are physically active often report feeling happier, having more energy, and sleeping better. It's a powerful habit that provides a wide range of positive effects for both your body and your mind. A practical way to incorporate more exercise into your life is to start small and build up gradually. Try aiming for a 15-minute walk after dinner a few times a week. You can listen to music or a podcast, or simply enjoy the quiet. Once that feels comfortable, you can slowly increase the duration or frequency of your walks. The most important thing is to begin. Now we need to talk about a very important habit: not smoking. This one is straightforward. Not smoking means completely avoiding all tobacco products, including cigarettes, cigars, pipes, and smokeless tobacco. For those who have never smoked, the best thing you can do is to continue to avoid it. For those who do smoke, the most powerful step you can take for your health is to quit. The way smoking affects the body is direct and harmful. Tobacco smoke contains thousands of chemicals, and many of them are known to cause cancer. When you inhale smoke, these toxic chemicals enter your lungs and can travel through your bloodstream to the rest of your body. These chemicals can damage your DNA, which is the instruction manual inside every one of your cells. When DNA is damaged, cells can start to grow out of control, and this is how cancer can begin. Smoking is the leading cause of lung cancer, but it also increases the risk for many other cancers, including those of the mouth, throat, bladder, and stomach. The benefits of quitting smoking start almost immediately. Within minutes of your last cigarette, your body begins to recover. Over time, your risk of developing cancer begins to drop significantly. After about 10 to 15 years of being smoke-free, your risk of lung cancer is cut in half compared to someone who continues to smoke. Quitting smoking is truly one of the most impactful health decisions you can make. It adds years to your life and improves your quality of life in countless ways, from easier breathing to a better sense of taste and smell. If you are a smoker and want to quit, remember that you don't have to do it alone. There are many resources available to help you. A valuable first step is to talk to your doctor. They can provide guidance, support, and information about tools like nicotine replacement therapy or counseling programs that have helped many people successfully quit for good. Let's move on to a habit that is often overlooked: getting good sleep. Good sleep isn't just about the number of hours you're in bed, it's about the quality of that rest. It means falling asleep without too much trouble, staying asleep through the night, and waking up feeling refreshed. Most adults need around 7 to 9 hours of quality sleep each night to function at their best. What is happening in your body while you sleep? Sleep is a very active time for your body's repair and maintenance systems. While you rest, your body is hard at work, cleaning up waste products from your brain, repairing damaged cells, and strengthening your immune system. One important process that happens during sleep is the regulation of hormones, including melatonin. Melatonin not only helps you feel sleepy, but also has protective qualities. When you don't get enough quality sleep, these vital repair processes can be disrupted. Over the long term, poor sleep can contribute to an environment in the body that is less effective at keeping cells healthy. The benefits of good sleep extend to every corner of your health. A well-rested mind is sharper, your mood is more stable, and your immune system is more robust. Getting enough quality sleep is a valuable part of supporting your body's natural ability to stay healthy and balanced. It helps you have the energy to exercise and make healthy food choices, creating a positive cycle of healthy habits. For a practical tip to improve your sleep, try creating a relaxing bedtime routine. About an hour before you plan to go to sleep, turn off bright screens like your television and phone. Instead, you could read a book, listen to calm music, or take a warm bath. This helps signal to your body and mind that it's time to wind down and prepare for a restful night. Next, we will discuss maintaining a healthy weight. A healthy weight is the weight range that is appropriate for your height and body composition. It's not about achieving a certain number on the scale or fitting into a specific size of clothing. Rather, it's about having a level of body fat that does not put an extra strain on your body's systems. Additionally, excess body fat can create a state of chronic, low-level inflammation in the body, which can also contribute to an environment where cancer is more likely to develop. The benefits of maintaining a healthy weight are far-reaching. Let's turn our attention to sun protection. This habit is all about protecting your skin from the harmful effects of the sun's ultraviolet or UV rays. This doesn't mean you have to avoid the sun completely. It simply means being smart about your sun exposure. This includes using sunscreen, wearing protective clothing, and seeking shade during the times when the sun's rays are strongest. How does the sun affect your skin? The sun emits UV radiation, which can damage the DNA in your skin cells. Your body is usually very good at repairing this damage, but over time, with repeated exposure, some of that damage can accumulate. When the DNA in skin cells is damaged beyond repair, the cells can begin to grow and divide uncontrollably, which is how skin cancer develops. Sun protection acts as a barrier, reducing the amount of UV radiation that reaches your skin cells in the first place. The primary benefit of good sun protection is a significantly lower risk of developing skin cancer, which is one of the most common types of cancer. It also has the added benefit of preventing premature aging of the skin, such as wrinkles and dark spots. Protecting your skin helps it stay healthier and look its best for longer. Here is a practical tip you can use every day. Make applying sunscreen a part of your morning routine, just like brushing your teeth. Choose a broad-spectrum sunscreen with an SPF of 30 or higher and apply it to all exposed skin, including your face, neck, ears, and hands. Do this every day, even on cloudy days, as UV rays can still penetrate through the clouds. Now let's talk about the habit of drinking less alcohol. Similar to the advice on smoking, the recommendation for cancer prevention is that it's best not to drink alcohol at all. However, if you do choose to drink, the key is to do so in moderation. For women, this generally means no more than 1 drink per day, and for men, no more than 2 drinks per day. How does alcohol affect the body in a way that can increase cancer risk? When your body digests alcohol, it converts it into a chemical called acetaldehyde. Acetaldehyde is a toxic substance that can damage the DNA inside your cells, preventing them from repairing themselves properly. This damage can lead to uncontrolled cell growth. Alcohol can also increase the levels of certain hormones like estrogen, which can fuel the growth of some types of cancer, such as breast cancer. The effect of alcohol is even more pronounced when combined with smoking, as the two habits together greatly increase the risk for cancers of the mouth and throat. The main benefit of drinking less alcohol, or not drinking at all, is a reduced risk for several types of cancer, including cancers of the mouth, throat, esophagus, liver, colon, and breast. Limiting alcohol intake is a significant and positive step you can take to support your long-term health. It can also lead to better sleep, improved weight management, and better overall health. As a closing thought, if you are looking to cut back on alcohol, try exploring some of the many non-alcoholic alternatives that are available today. Finally, let's discuss the importance of regular checkups. This means visiting your doctor for routine examinations and recommended cancer screenings, even when you feel perfectly healthy. These checkups are a cornerstone of preventive healthcare. They provide an opportunity for your doctor to assess your overall health and to catch potential problems at their earliest stages. How do regular checkups and screenings work to protect you? The goal of cancer screening is to find cancer early, before it has had a chance to grow and spread, and often before it even causes any symptoms. When cancer is detected at an early stage, treatment is often much more effective, and the chances of a successful outcome are much higher. Screening tests are designed to look for specific signs of cancer. For example, a mammogram is a screening test for breast cancer, and a colonoscopy is a screening test for colon cancer. The benefit of regular checkups is clear. Early detection saves lives. It is one of the most powerful tools we have in the effort to improve outcomes for many types of cancer. These appointments also give you a chance to talk with your doctor about your personal risk factors and to get personalized advice on which screening tests are right for you and when you should have. Body them here is a practical tip. Take an active role in your health by talking to your doctor about a screening schedule that is appropriate for your age and health history. Write down the dates for your next recommended screenings on a calendar, or set a reminder on your phone. Being proactive about your health is a habit that can provide you with peace of mind. We've covered a lot of ground today, from the food on your plate to the importance of a good night's sleep. The main message is that you have the power to make choices every day that support your body and your health. What is one small change you feel you can make this week after hearing this information? We would love to hear your thoughts in the comments below. Your journey and your experiences can inspire others in this community. And if you found this video helpful, please consider subscribing for more content on how to live a healthier life. Thank you for watching.